right. Let's go ahead and get started with the Carol Hollenshead Award presentation. We have an amazing group of faculty and staff who are doing advocacy work in our communities, and so we want to go ahead and get that going. Thank you, Doreen, for providing us with time to refocus and to be present in the here and now. If you ever need to recenter, please join us at CEW for a midweek mindfulness sit that will be similar to the one you just experienced. Our mindfulness sits always happen on Wednesdays at 12:15 and are open to anyone from the community or the campus at no cost. Good afternoon. My name is Tiffany Mara, and I'm the director of CEW. All of us at CEW are glad that you could be here today to celebrate our Carol Hollenshead Inspire Award winners. CEW created the Carol Hollenshead Inspire Award for excellence in promoting equity and social change in honor of our former director, Carol Hollenshead's 20-year tenure at the Center for the Education of Women. Carol was known for her passionate pursuit of equity for women and other marginalized groups, and received numerous awards, including the 2008 Sarah Goddard Power Award by the Academic Women's Caucus for her constant, tireless, and unflagging support and promotion of women. The Hollenshead Inspire Award recognizes U of M students, staff, and faculty whose sustained efforts have resulted in greater equity in the university community and beyond. We're fortunate to have Carol's family here with us this afternoon. Please join me in giving her family, Bruce and Evelyn, a round of applause. Carol's 70th birthday would have been yesterday. In honor of her birthday, I'd like to take a moment of silence to honor and remember Carol's life and legacy. So please, a moment of silence. And thank you again to Carol's family for being with us here today. At this time, I'd like to say a special thank you to Doreen for leading the CEW Inspire Selection Committee, including Pam Smock, Carol Welsh, Erica Mercio, Susan Guto, Lee Gorman, Sierra Merriman, and Jacqueline Kaufman. It's an honor to have you as partners in this work. In addition to presenting lightning talks at this event, each award winner will also lead a workshop related to their lightning talk sometime over the next 8 months. The full workshops will expand on the topics they cover today and also include a hands-on wellness activity aimed at building coping and resilience skills for us who are doing the work. There's a handout in the program that lists the times, dates, and a description of each of their workshops. We hope you'll be inspired today and also attend their workshop. At this time, Doreen's going to join me back on the stage to provide introduction to the Lightning Talk Award winners, or to the Carol Hollenshead Inspire Award winners.
So you'll now be hearing from our 5 recipients of the CEW Carol Hollenshead Inspire Awards. The amazing work of these faculty and staff members focuses on at least one of the 4 areas: sustained effort and demonstrated outcomes in achieving greater equity in this community or beyond, creativity in devising strategic approaches to advocacy and problem solving, demonstrated commitment to diversity and inclusion, and effective coalition building. If you have a question for one of our presenters, please share your question on the index cards available at your table. You can hold up the index card to be collected by one of our staff volunteers. And you can do that again anytime during the presentations if you have the question, and we will get to them at the end. It's an honor to introduce our first recipient and presenter, Dr. Natalie Sampson, Assistant Professor of Public Health at U of M Dearborn, where she teaches courses in environmental health, community organizing, and health promotion. Grounded primarily in Southeast Michigan, she studies transportation and land use planning, stormwater infrastructure, vacant land reuse, and climate change planning efforts, particularly their impacts on health. She applies participatory research approaches with diverse partners using a broad methodological toolkit, including photo voice, concept mapping, and health impact assessment. In 2017, Dr. Sampson received the American Public Health Association's Rebecca Head Award, which recognizes an outstanding emerging leader from the environmental field working at the nexus of science, policy, and environmental justice. Dr. Sampson's holds a Bachelor's of Science from U of M's School of Natural Resources and the Environment, now U of MC's, and an MPH from the Portland State University, and a PhD from U of M's School of Public Health. Let's welcome Dr. Sampson to the stage.
Thank you, everyone, and thank you to CEW and Carol's family. It's an honor to be part of this legacy. So as Doreen said, I do work related to environmental racism and trying to address the health implications of decisions we make across different sectors. So these are the numbers that keep me up at night when I'm putting my kids to bed and I'm holding them after we read stories. 2, if you know, 2 degrees Celsius is the number that scientists have said we have a 5% chance of keeping at bay with greenhouse gas emissions. And even if we get rid of our carbon emissions, we're probably not going to keep below 1.5 degrees of warming. 11 is a number last year the IPCC scientists said we had about 12 years, not till the world ends, but until we don't know really what the projections and the uncertainty and the feedback loops of climate change look like. And so to me, this is urgent, this is timely, this is overarching, driving the work I do, and it means that not everyone's going to experience it the same way. For instance, in Michigan, with heat, we know that people are going to be having issues with transportation and underlying chronic health conditions and getting to where they need to go. So we need to work on it now. But as a researcher, I grapple with this because I know that changes in Lansing and DC aren't just coming from research, right? It's coming from people who are launching campaigns, who are calling on decision makers, who are trying to educate us, who are demanding the research happens. And so this is just a picture of some youth fellowship group that we developed in Dearborn. A lot of residents from South Dearborn, from Yemeni American students who are trying to figure out what to do about the fact that most of the facilities in their neighborhood are egregious violators of the Clean Air Act. That their asthma rates are about double, their uninsured rates are about double than other parts of Michigan and the country. So I want to figure out how to help them in a way that I know how to use my skills. But research is really slow, and grants and papers that are in peer-reviewed journals are really important, but they're really slow. And so I just wanted to talk really briefly about a couple of other tools that I think might be helping to weasel the conversation of public health into these decisions. So using integrated assessments, using multimedia, using toolkits to synthesize existing evidence-based research, creating health impact assessments. So the last one is related to the Gordie Howe International Bridge, if anyone knows about the fact that we have a privately owned bridge in Detroit right now, and we're about to have another one. So these are all land use infrastructure decisions that don't always consider health. And so with my community partners and residents of fence-line communities and government agencies, how do we quickly turn around some of these findings? How do we quickly work on these issues when we know that environmental justice is a core issue? And this is at odds. I just said this. This is hearkening back to our morning talks about aligning our values with the work that we do. And I think it was Shannon that said to take rest but not quit. And Stephanie mentioning the fact that she needs to work on her boundaries. I do too. All of these things we have to figure out how to do better, because I think that focusing on the future at this point is a really privileged pursuit, because when I'm studying stormwater, I have people dealing with sewage in their basements that I work with. There's people who are showing up at urgent care, folks who are living across the street from an international border plaza today, right? These things are not happening in 5-10 year timelines as our research plans might be. And so I'm calling on us, this is a conversation that happens in academia a lot, but to reevaluate what counts and what matters. And so working towards questions that answer practice-based questions, getting our information out to the world, whether that be through health impact assessments or multimedia, in addition to peer-reviewed journals. And again, this is past our capacity, so how do we build that into our grants? How do we build that into our partnerships? How do we make sure people are paid to tell their stories as much as we are paid to publish peer-reviewed journal articles? And so the gift's not working, but this hustle is not to do more and faster, but it's to work smarter, right? I think myself, I'm guilty of taking on too many projects. And so how do we do fewer projects but do them well in a way that we're actually addressing some of these environmental justice issues today as we think about that number 2 and that number 11. So I think I kept to my 5 minutes. With that, I hope I will see you all on May 7th, where we're going to talk about staying up at night, thinking about climate change, and how do we confront that, and how do we handle this in a way that we can move forward with coping and resilience. And so hopefully some of you will be in the room with me as we tackle this conversation together. So thank you again.
Let's give one more round of applause. Thank you so much for the work that you're doing. Okay, our next recipient and presenter is Wendy Ann Woods, former city councilwoman. Wendy served the citizens of Ann Arbor from 2001 to 2007. She is a strong advocate for affordable housing, a vibrant downtown, a balanced budget, a living wage ordinance, and corporate social responsibility. She earned a Bachelor's of Science degree in Forestry Management and a Master's of Science degree in Environmental Policy and Management at the School of Natural Resources and Environment, now U of M Cs. Woods is the Associate Director of the Michigan Community Scholars Program, a nationally recognized living learning program at U of M that focuses on social justice, community service, diversity, and civic engagement. She also teaches a seminar for students in MCSP, is a member of the Association of Black Professionals, Faculty, Administrators, and Staff at U of M, and serves on the advisory board for the University Outreach Council. Please join me in welcoming Wendy Ann Woods to the stage.
Just making sure I understood the technology that we have up here. First of all, I want to thank CEW so much for this wonderful award. And in particular, it means a lot to me because I was a friend of Carol Hollenshead. And so it's wonderful also to see her family here. Carol and I spent a lot of time in meetings. We were part of the President's Advisory Commission on women's issues here at the University of Michigan. And I always knew Carol to be a visionary, an agitator, and a leader. And I just wanted to say that I think we're all made better for her having walked and worked on this campus. So thank you again so much. My title is Boldness Rules the World, Sustaining Leadership. In some cases, it's not that hard to become a leader, but the fact of the matter is, how do you sustain that? And so today I'm just going to spend a few moments talking to you about this, and then hopefully again I'll see you in March, which is Women's History Month, and I think it's an appropriate time to talk about how do we sustain our leadership. So a good friend of mine told us years ago that one of the things that he had 7 ups to success. Does anyone here drink 7-Up Pop at all? Or soda, I guess, if you're from, okay. Well, if you know what I'm talking about, it's an easy way to think about things that you might want to do in order to sustain where you are. So just think about the 7 ups for success. And I put them here for us to look at. But it certainly is something that I often remind my students. I work mainly with undergraduate first-year students here at Michigan. The first thing is you got to wake up. So, you know, that's not all that easy to do sometimes for students because they are used to having perhaps parents wake them up. But now it's the ball is in their court, so to speak. So you got to wake up. And not only do you have to wake up, you have to dress up. I'm not a proponent of wearing your pants slouched. I know that some people are, but I'm going to go there and just say, you got to act as if you are coming to the university for business. The second thing is you got to show up. If your professor has to be at the class, then you ought to be there too. So I'm not a proponent of missing classes and then coming in and saying, can you tell me what I missed? No, I can't tell you what you missed. You need to show up. The next thing is speak up. And this is particularly relevant for us as women who often find that our voices have been muted or silenced, or that we say something that is just wonderful and no one says anything, and then the next thing you know, someone else across the room who might be a little bit different than you says it, and people are like nodding their heads. And you're sitting there thinking, I just said that. So one of the things I want to encourage us to do is if you hear a woman make a wonderful statement, if you're going to repeat it, give her credit for that as well. And I think that's something that we can certainly learn to do. The next thing is to stand up. It's not always easy to stand up and to say what you know is right. We have some horrible examples of what's happening in our Congress right now, but we don't have enough time to go into all that. But we certainly need to find some folks who have the courage to stand up and to say, hey, the emperor does not have on clothes. And I just wanted to throw that out there, and now I'll get off of my soapbox. But you all know that I'm a politician, and every now and then we just can't help it. We got to go there. The other thing is to look up. Don't be a person who's so busy taking care of your own business that you don't look up to see what's going on around you. To be able to get a sense of your community, of your campus, to take part in that. You know, I think that getting a college education is a participatory experience, and it's important for all of us to be able to do that. The last thing is to lift up. Many of us in here already have U of M degrees. How many people in here have a U of M degree? Just raise your hand. My, you all are some smart folks. And of course there are some other universities out there, but I'm not going to go down the list. But the fact of the matter is, we have those degrees, I believe, particularly because we got them from a public institution paid for by the taxpayers of the state, that it is incumbent upon us to lift up and to look back. If you were able to receive that wonderful education, then it's important for you to open the door so that someone else can come in behind you. And I think if more of us think about doing that, that can bode well for our future. My grandmother used to say, and it wasn't her own original saying, she got it from somebody else, but that's okay, because I like to say my grandmother used to say. But what she used to say was, a ship in a harbor is safe, but that's not what ships were made for. And I wondered, what was she talking about? And the older I get, the more I realize that that is certainly a true statement. And what it means is sometimes you do have to take a step. You have to go where it might feel uncomfortable. And I think we're hearing that word today. And let's just encourage each other to do that as well. But those aren't the only ships. And I put a few ships on the page that I wanted to mention. And you probably, over your lunch, will be able to come up with other ships that perhaps I didn't mention. But there's fellowship. There's relationship, friendship, kinship, scholarship, and worship. And I know where I am, and I know that there are some things that, as a public institution, we don't necessarily touch. It's like that third rail out there. But all of these, I think, are terribly important. Does anyone have a ship out there that perhaps I didn't put on this list? Anybody? No? Oh, yes, ma'am. Stewardship, incredibly important. Thank you so much. Absolutely. I'm going to quickly go through these slides at this point because I was told that I got 1 minute. But one of the things I do want to say to you is I just want to encourage all of us as we're thinking about sustaining our leadership or anything else in life. One of the things you really need to do when you get up in the morning is to make up your mind to be happy. Learn to find pleasure in the simple things in life. Read more. You know, when you get up in the morning and you look in the mirror, if the person in the mirror says, "What are you looking at?" You can say, "Well, self, I think we're going to make this a really good day, and let's get started." As you can see, there are some things that I am not going to talk about right now, but this I hopefully is just going to whet your appetite. I hope to see you March 20th, and we can certainly talk about all of the ships and make sure none of them are passing us by. Thank you so much.
Let's give Wendy one more round of applause. Our next recipient is Dr. Marita Inglehart, Professor of Dentistry in the Department of Periodontics and Oral Medicine at the School of Dentistry and an Adjunct Professor of Psychology in the Department of Psychology in LSNA. Her teaching of dental and dental hygiene students focuses on educating patient-centered and culturally sensitive future dental care providers who appreciate interprofessional collaborations. Her research focuses on the role of psychosocial factors in providing care and increasing access to care for underserved patient populations, such as patients from socio-economically disadvantaged and or racial ethnic minority backgrounds, patients with special health care needs, and or from the LGBTQ plus backgrounds. Please join me in welcoming Dr. Inglehart to the podium.
Okay, so first, a very heartfelt thank you very much to the Hollenshead family and to CEW for this award. I have very fond memories of Carol. So being a solo person in an organization, how to survive and create change, makes me wonder how I can get you all think about a situation where you are a solo person, then walk with you through what I think I learned since February 1990 when I started in the dental school, and come out at the end wondering what else would be there that makes our life easier, because I'm pretty sure that everybody in this room, it resonates with you when we talk about being a solo person in a situation. So here I was being a solo person in the dental school, being the only psychologist. And two things that solo persons basically face on a daily basis is devaluation. One of my senior, very esteemed colleagues said, "You Tootsie, what do you know about dentistry?" after I was hired. And exclusion. I'm the only faculty member who lives in the basement since 1990. And while that had some advantages, when I had little kids and needed to get out more often than they most probably wanted me to get out, it's definitely a sign of being a solo person that you are not included in most of the things that the majority is kind of passionate about. What helped me? 3 strategies from a wonderful social psychologist that nobody in the US knows, because sorry to say he was French or Romanian and lived in France and wrote everything in French. And those 3 principles were that you have to be persistent, you have to be consistent, and you have to keep up your kind of sense of positive self-esteem. How can we improve when I think about persistent? From very early on in my childhood, growing up with an aunt who was sterilized by the Nazis because she was not without disabilities, I always kind of thought about how can we improve the situation for people with disabilities. I went to the dental school and I was very persistent, and I started to think we have to do more education-wise, and not just with the students, but with the faculty, especially the clinical faculty that treat these patients and show the students how to do it. Since January 2002 till now, we organized 157 monthly free continuing education courses with now over 15,000 participants about providing care for patients with special health care needs with disabilities. I will do this till I retire. What does Moscovici think about when he says we have to be consistent as a minority, as a solo person? How can we improve the situation for patients with special health care need and or from other backgrounds? And again, my answer always was provide the message in teaching, service, and in research. Keep it consistent in your whole life. Teaching, since '94, we have an orientation now that I give for the dental and the dental hygiene students where I introduce them to this topic. We take them to the African American History Museum on the second day of their orientation. And from the moment they come to the dental school, we talk with them about what it means to be a healthcare provider that treats diverse patients. The service, in addition to those continuing education courses, we have monthly getting to know you sessions. We have a multicultural mirror 3 times a year. And so we try to weave in the dental school this all throughout the culture to be consistently thinking about these questions. Research, my research, about a quarter of my publications are exactly about this topic in dental education and dental settings since 1997. And with a positive perspective, that got me to realize that I have 3 things that I appreciate tremendously. The 3 lessons learned are, first of all, that leadership is crucial. Think back 1990. We had a fantastic dean that was very supportive of the things that I value. We had others in between that were not supportive. And now we have one that is fantastic. And that made me realize how grateful I am when we have supportive leadership, and we as a university should be very grateful for our president. Building effective coalitions is a must. Whatever we achieved, I'm just the tip of the iceberg you see here, because nobody could do this alone. We have a wonderful supportive group of staff, especially of faculty members in the Multicultural Affairs Committee, of students. And so building an effective coalition when you are a solo person is an absolute must. And finally, believe in your work and find meaning in your work, and never forget that. When I look at this is 1933, just before everything broke together in Europe. And Margaret put this kind of easel in front of the window and said, we have to capture the human condition. We have to do that. We have to look out there, and we have to document, and we have to respond to it. And hopefully we capture many, and we are able to make the world a different place when we do that. On November 14, I would be happy to see many of you in a workshop where we can talk about these issues more. So, 3 strategies, 3 lessons learned. They helped me survive as a solo person. They resulted in concrete steps in teaching, service, and research, and hopefully in some positive change in the lives of some others.
Let's give Dr. Inglehart one more round of applause. Thank you. So joining us now is Dr. David Michener, the curator at the U of M Mathi Botanical Gardens and Nicholas Arboretum. Best known to the public for his co-authored book, Peony, which made the New York Times 2018 summer reading list. His research addresses understanding the complex cross-cultural heritages of ornamental peonies and conserving key living specimens. He's an active program in molecular evidence of peony relationships with colleagues and students here at U of M and in Belarus. His work with indigenous seeds in museum collections is an unanticipated intersection of deep engagement with U of M's Museum Studies program and an ethical concern with the voice of indigenous communities in interpreting native plant collections and landscapes stewarded by the Botanical Gardens and Arboretum. Before coming to Michigan, David earned his BA in botany from UNC Chapel Hill, and his PhD from Claremont Graduate School was followed by an NSF-funded postdoc at Harvard's Arnold Arboretum. Let's welcome Dr. Michener to the stage.
The University of Michigan is on historic tribal lands, and we have had 2 centuries of challenging and at times extremely contentious interactions with the 12 tribal nations of this state. The Anishinaabeg nations, better known to many of us as Chippewa, Odawa, and Potawatomi, are sovereign nations with proud and contemporary peoples. Today's perspective is based on more than 15 years of work, which has been mostly learning how to listen. Rematriation is about seeds, seeds going home. At a transition point in another extremely contentious interaction of the tribes and universities, one of the elders, Sidney Martin, shown here, asked if there were any seeds in the university's collections. The answer is more than 4,000 seed collections are in the archival museums, and that they are known with their data as to whose garden, where it's from, when it's from, and ancillary notes. This is a potentially extremely difficult situation. What we have here is community-sponsored research under the guidance of the elders, who are all women. This is a matriarchy. Knowledge flows through the matriarchy. This is community-centered research about its questions, its protocols, and its evaluations, and the central issue is these seeds are spiritually alive. They are our kin. They are here dying in the museum. How do we bring them home? Rematriation is about relationships. It is seeds to place. It is seeds to people. And remember, everyone who knew them is dead. But the communities remember. It is seeds to ceremony, including new ceremonies that must be made to create the welcoming space for them to be. And everything must be done by the traditional protocols as determined by the matriarchy. I am a guy. I'm not tribal. There's been much to learn by listening. You might wonder, where are the university students in all of this until fairly recently? And the tribal elders, the Meday, the women, were very clear about this, that in these years of developing the relationships, that they had to determine whether a project at this, coming out of this university, was a continuation of the historical trauma and genocide of the boarding schools by which the culture was nearly annihilated. Was this, quote, just another deception? These are the living relatives. To do this has required traveling extensively and learning throughout the Great Lakes, and most of all, learning how to listen, and how then to be supportive of other people's finding their own heritage in places we steward. The last 2 years, we've had Harvest Feast, which are only announced after they have happened for reasons of cultural security, and the harvests are deepening the relationships. There's a great story about the watermelon here, but more importantly is the eagle staff of the Little Traverse Bay Band of the Odawa Indians. I'm unaware of, other than the powwow, it has ever been on the university property. The seeds renew relationships of ourselves and to the peoples of the cultures. This past year, and just 2 weeks ago, we had the Harvest Feast, was bringing back a corn that is grown only by one tribal elder in northern Minnesota, 18 hours drive from here. Meeting with him, there in red, Jacques Desjarlais, that's not his real name, but it's how he goes on everything. Naming is an interesting convention. But how do these seeds come back to the community to support tribal farms? Nutritional studies, obesity and malnutrition are severe, both on and off reservation, and in the restoration of language and culture, including at this university, which is unique amongst major universities of the Great Lakes of not having a strong indigenous language component. The request here is to do community-centered research with the community. And over the years, what we have done is worked with most of the nations of the state, with more than 12 different departments of this university, as ways to find linkage points to engage as the seeds find their way home. And so to all who have funded, I thank you. This is quite a relationship building one, and we all look forward to a new way. Miigwech. Thank you. A peony. Thank you.
All right, one more round for David. Amazing work. Our final recipient and presenter is Dr. Michelle Mead, Associate Professor in the U of M Department of Physical Medicine and Rehabilitation. As a rehabilitation psychologist, she conducts research with, provides clinical services to, and advocates for individuals with physical disabilities. Dr. Mead is currently the principal investigator and director of 2 federally funded interdisciplinary centers focusing on disability issues: the U of M Rehabilitation Engineering Research Center and Technology Increasing Knowledge, Technology Optimizing Choice, which is focused on developing and evaluating mobile technologies to enhance health management and independence among adolescents and young adults with disabilities. And the Rehabilitation Research and Training Center on investigating disability factors and promoting environmental access for healthy living, which is focused on promoting healthy aging for individuals with long-term physical disabilities. Dr. Mead also serves as a co-chair of the Michigan Medicine Disability Council and the co-director for the U of M Collaboratory for Disability Health. Welcome, Dr. Mead.
Thank you very much. 61 million Americans, or 1 in 4 people in the United States, are living with a disability. Individuals with disabilities have worse health, engage in poorer health behaviors, and have more negative outcomes than those without disabilities. These include higher rates of depression, more suicide attempts, more hospitalizations, and higher levels of cognitive problems and health illiteracy. Individuals with disabilities are among those who most need access to informed and appropriate medical care. And yet, what we find is this group is more likely to have unmet healthcare needs, to experience cost barriers in receiving treatment, to have times when they're unable to access care, and to be likely to report encounters characterized by disrespect and not being listened to. And they're also less likely to receive preventative care services, have access to routine dental care, or to receive counseling associated with alcohol or substance abuse, smoking cessation, or mental health issues. Here at Michigan Medicine, we interact with a lot of patients. In 2018, we provided care during about 2.5 million outpatient clinic visits, over 100,000 emergency department visits, and during over 300,000 patient days. This means that every year, Michigan Medicine interacts with individuals with disabilities a lot. At minimum, this includes about 500,000 outpatient clinic visits, over 20,000 emergency department visits, and over 62,000 patient days. These outcomes, though, are up on us. We can do something about it to change them. The outcomes of poor health and poor access to quality care tell us what we need to do. We have the ability to consider how to change the environment that we have created, that we provide, as well as our knowledge and attitudes, our buildings and our systems, to better meet the needs of individuals with disabilities so that their health and functioning can improve. We can consciously create environments. We can ensure accessible clinic and office space and equipment which individuals with disabilities can actually use. We can ensure there are space and services for those with cognitive and sensory impairments. We can enhance awareness that disparities in healthcare and healthcare outcomes exist and identify our own biases, limitations, and priorities. We can optimize the attitudes of all stakeholders, promoting positive attitudes about disability and disconnecting the idea that disability necessarily means poor health and poor quality of life. And we can promote expectations of participation, inclusion, and engagement. We can educate providers. We can provide courses on disability as part of our curriculum. We can provide continuing education to our professionals. And we can create best practice alerts that provide just-in-time information about the challenges for that particular individual with disability in our healthcare medical records. We can gather data using measures that are appropriate for and validated on or with individuals with disabilities. We can ask, do you have a disability for which you need an accommodation? Currently, my chart does not have a standardized field to list if a disability or accommodation is needed, which then leads to many trickle-down effects. We can regularly screen for functional deficits, being it sensory, cognition, or mobility. And then we can adapt and tailor care to address what we find. This is not just sending a referral, but actually changing the care we provide so it is understood by and relevant to our patients. We can review and update our policies so that they meet not only minimum regulations from the Americans with Disabilities Act and other regulations, but actually are about the best practices for the health of our patients. We can also advocate for state and federal policies that impact our patients' health and quality of life. Finally, we can translate all of the wonderful, innovative, cutting-edge research that we do here at Michigan back into our clinical services so that our patients benefit from the technology, from the research, from all that we have worked to find out in partnership with them. In summary, individuals with disabilities comprise a large percentage of who we serve here at Michigan and Michigan Medicine. Poor health and healthcare outcomes are not inevitable for this group, but influenced by what we as healthcare providers do or do not do. We need to step up to the plate and make changes based both on our research evidence and federal regulations in order to optimize outcomes. Healthcare disparities is about us, healthcare systems and healthcare providers. Addressing them and eliminating them are our responsibility. Thank you. Consider joining me in June for my workshop, Trying to Make a Difference, an Iterative Approach.
Okay, thank you, Dr. Mead. Now I would like to, if anyone has any questions that they've written down or anything, please hold up your cards so we can bring them forward. That would be great. And then I would like to first just invite all of the members that have presented today to join me on the stage. And what I guess I want to just say is how amazing it is when people connect their passion with work that needs to be done in the world. And what a broad range of just interests that we saw reflected here today. And I just want to again just say what an amazing panel and what a fitting honor in Carol Hollenshead's memories. So thank you all. Well, while we're waiting for questions, and some of the panelists today started to allude to sort of how they even found their path into the work that they did. But I wonder if any of you could take a little bit of a word in terms of what sort of brought you to the work that you did, that you're doing in the world. It's a very big question, but...
You know, I realize more and more that it's personal connections that bring me and get me motivated. And that's not a very scientific approach, but that's just as a person, how I kind of respond to the world. So having lived with an aunt who got sterilized definitely made me a different human being. And made me interested in other things than I might have been interested if I hadn't had that experience. So I'm not sure if that's a very scientific kind of approach, but it definitely is something that motivated me.
I do think it is this interaction between an intellectual area and a personal experience or interest. For me, it was having friends with disabilities and then thinking about where I was in the healthcare system and having to face answers or having to help people navigate the system or apologize for the way they're treated or the problems there are getting into rooms and such and saying, okay, this is something we can change.
Yeah.
I was just going to say, when I was a child, I was very loquacious and was always asking questions. And I think that becomes a part of the fact that, remember, I think it was President Kennedy said, you see things and you say, some people say why, others say why not. And so I think that's just a part of who you are and you finding your passion.
For me, it was having relationships beginning with tribal peers and partners and hearing about situations. And when the seed question came up, the seeds aren't even in our institution. They're in another one of the university museums. There was this more than a voice in my body, and it was, how can you do nothing?
I'll just say the same. I think the personal and the professional experience is interacting as an opportunity. So having, family who were sick with illnesses from industry at a very younger than they should have been age, and then going off to college as the first, and finding some mentors who taught me what different models of research looked like. Being like, oh, I do like research, and and figuring that out kind of at the same time.
Wonderful. And is everybody? Okay. David, this is a question for you. How do you move Native projects to center U-of-M missions and R1 research?
Great question about research, and it requires us at an R1 institution to reframe some of our research agendas around what the community needs, how the community perceives its needs, and to network with other research colleagues, students, and foundations to find the way to do new kinds of research. and for the seeds and returning them and all the nutritional and the public health benefits that the tribes see. It's so important that this be framed as co-authored work, co-planned work, co-managed work, and leads to enhanced tribal institutional integrity. And that's where I think U of M has great potential for leadership, not for us doing it, but for us being great collaborators.
Wonderful. Which leads to another question in terms of all of you, the work that you talked about is work that is much bigger than you talked about than one person. So how do you bring people to the table and bring people along to join you and partner with you to get the work done?
I think there are a lot of meetings. It is about forming relationships. It's about building trust. And then it's, I think, about getting down to specific projects, finding actionable things that you can work on together. It's putting up other people's ideas and promoting them rather than just yourself, and providing a larger vision of how the work fits together.
I would say in the work that I do, it's should I be at the table? I mean, there are a lot of meetings that a lot of frontline communities are going to, they have to be at the table. So am I adding value? Am I bringing something that's useful to the conversation?
I think earlier I was at one of our workshops about advocacy, and certainly that is so important in terms of bringing others in. And organizations like CEW have been doing this for years, and I think that's terribly important in terms of making people more aware and more educated about issues.
Building trust and relationships across borders, not just with other faculty, but more with staff, with students, is absolutely crucial, I think.
Go there. Don't ask people to come to Ann Arbor. Go there. Have a meal together. Have several meals together. Share the bathrooms. Become people. Because then people can decide what they think of you. Are you someone that can be trusted? Because if you can be trusted, then maybe this university can be trusted too. The last thing to do is to ask people to come here. But when you do, there are institutions such as the Graham Sustainability Institute that have planning grants that can help bring people here. Make certain that you are compensating people for their time, their expertise, their travel, their hosting. It's a privilege for us to have people to work with. It is not a privilege for marginalized communities to spend resources coming here.
One other thing, are there other questions, Kirsten? Do you have others coming forward? Well, before I turn it back over to Tiffany, one thing I want to say is, firstly, is just to thank you all for being here, and I hope that you do engage with us over the next 8 months and do join us in their workshops, where we'll have more time for continued conversation and also time after their presentations to talk more in community. The other thing I want to say is that the reason we did start today with mindfulness, I think part of really being able to do sort of the work that needs to be done in the world is really being able to start with the self and finding the center. I think David, I think all of you alluded to the importance of not only really being able to sort of be with ourselves and listen deeply to what's important to us, but also being able to be really good listeners with those around us. And really being able to, I think, build community does take that trust. And I think even there's so many divides in our country right now, if that we can all sort of learn to try to take that pause button before we move into quick reactivity, it really then provides more opportunity for us to have some true dialogue so we can really move things forward. So that's what I wanted to sort of link back to why we started that today and why that's so integral to this program that we're doing in terms of the Inspire program, is really bringing that tool is something that we can all use.
Thank you again to our Inspire Award winners, not just for being here today, but also for the hard work that you're doing to promote equity and social justice on campus and in the community. All of it's extremely inspiring work that you're doing. So I applaud you for that. Let's give them one more round of applause. So after this lunchtime session, we're going to break into our afternoon workshops. And then at the end, Larita Thomas, who's in the back, Larita, back there, is going to, yeah, no kidding, let's give her a round of applause. We'll be leading roundtable discussions to close out the day, followed by a reception that's sponsored by the Barger Leadership Institute. I hope you can stay with us throughout the day. The roundtable discussions are very much going to be action-focused about what we can do to address HR challenges that exist on